amazed, overwhelmed and delighted that so many of you have come to our group and to see Eileen and to see all of us. It's lovely to have you all here. I think that's probably almost the biggest turnout we've ever had, which is great. Maybe it's something to do with the afternoon, who knows, and everything. Anyway, I think we've got quite a few new faces here, which is lovely, and I think they're all on the mailing list, aren't they? So if anybody isn't on anyone's mailing list, then do come give me your email. Now over to you, Susie.
Afternoon. Yes, I'm just overwhelmed and so delighted to see so many faces I haven't seen for a bit. Thank you so much for coming, and some I have seen more recently. It's really lovely, thank you. And today we have a lovely speaker, Eileen Doody, who does CranioSacral therapy and who I met in March 2021. And Eileen is the most amazing, effective therapist that has been so beneficial to me with a head trauma that I had and the resulting fallout from it with headaches and so on, poor sleep, etc., etc. Absolutely phenomenal results from the treatments, and I'm so grateful to Eileen for coming today and for all the help that she's given me. I could list even more benefits, like memory was going and concentration, goodness knows what, but yeah, all fabulous. So I'll pass you on to Eileen. Thanks, Susie. Thank you.
First of all, thank you so much for inviting me, and also I'm very grateful about the time because it really fits in with my structure at work and things. So it's lovely to meet you all. I must apologise in advance because I have no PowerPoint organised because I'm not very tech savvy. So you'll be listening to my voice a lot. And what I will say is, if you want me to repeat anything, please, ask, please say. I'm happy to repeat. I may get stuck for words at times. That can happen when I get nervous, so bear with me, I will break through that. And there'll be plenty of time for questions at the end as well. So if you have a burning question, if you can possibly hold on to it till the end, I'd be very grateful. So have any of you here had, apart from Susie, and I know there's a couple more who've had CranioSacral. Yeah. Is there anyone else in the room who's experienced CranioSacral therapy?
Oh no, it doesn't help. You've got to write it down. What is it?
CranioSacral therapy.
Sacral.
Yes, exactly. This is brilliant because this is exactly the reaction I get when I say what I do. So I'll explain more about that in a minute.
Sacral. Yeah.
Yes, so has anyone else received CranioSacral? You have? Great, brilliant. So the majority of you haven't, which is great. So how I came into CranioSacral therapy was I was practicing as a therapist with other therapies, and I started going for CranioSacral therapy for a back problem that I was experiencing. And I found it incredibly relaxing, very relaxing, and it was on the third session that I experienced a childhood trauma come up. Now I was aware of this childhood trauma, and it completely shaped my life. It's exactly why I do what I do. But I hadn't expected it to come up in such a way that it was actually in my body as well, that the feeling of it was in my body. And I still remember that session to this day, and that was a long time ago. So I knew at that point that I was experiencing something that was very different to the other therapies that I was practicing. And I wanted to know more, and obviously because this issue had come up, obviously it was coming up to be healed. So I went for regular CranioSacral therapy. I ended up referring a lot of my clients to my therapist because I realised that a lot of the things they were coming with were a lot deeper. They were very deep and perhaps trapped in their systems. So I was referring them on to my therapist. So at a certain point she said to me, why don't you just go and train in this yourself? So I thought, God, I'd never be able to do this. And I ended up training in it, and that's what brought me into CranioSacral therapy. And the training doesn't stop, if some of you are therapists or are there therapists here already. Some of you therapists know, or people who have had therapy realise that the training never stops. The work on the self never stops. So I'm continuously doing training to keep myself updated. So what is craniosacral therapy? So I like to explain it very, very simply by saying it's a very light touch therapy that helps the body to release deeply held tension and trauma that's trapped in the body. That's an easy way of explaining it. But often when people ask you, well, what do you do, craniosacral therapy, they give you this look as if, what the hell is that? It's a very technical word, it's very scientific. Cranio means cranium, which is bones of the skull and the skull itself. Sacrum is a triangular shaped bone at the base of your spine. It sits in between your hips. And of course, in between those two bones, those two areas, you've got the spine and the spinal cord. And that is your central nervous system, the spinal cord and the brain. So we predominantly work with the central nervous system. However, we work on any part of the body. The reason for this I will explain more about, but how we do this is, how do you work with the central nervous system through the body? You listen to the craniosacral rhythm. So what the craniosacral rhythm is, you've got a fluid in your brain called the cerebrospinal fluid. If you want me to slow down or repeat, please just ask. So your brain produces this cerebrospinal fluid. You produce between 400 and 600 mil of it a day. And at any one time you have 150 mil. That surrounds your spine and your brain, your spinal cord and your brain. So the very fact of you producing it and reabsorbing it into your system, it's a circular system, means that it's got a rhythm. And craniosacral therapists are trained to pick this rhythm up anywhere in the body through their hands. And because of this, like craniosacral therapy has been around since the 70s, we were kind of labelled as quacks because it's, up to this point, it was unscientifically proven about this rhythm. Like, you've got your heart rhythm, you've got your respiratory rhythm, your breathing, but how do you quantify this breathing that comes through, this rhythm that comes through the cerebrospinal fluid? But 2 years ago, there was a scientist who actually is a craniosacral practitioner and a teacher, and he undertook to prove to the scientific community that this does exist. And please don't ask me the name of the machine because I cannot remember it, but he used a particular machine to actually register this rhythm. And he produced a research paper and submitted it. So now it is scientifically proven. I'm sure there will be other scientific evaluations that go into that. So before we go any further, I would like to invite you to have a guided meditation to feel your own craniosacral rhythm, which you can. Those of you who have received treatments have felt it during the session, but I want you to feel it through your own hands to understand what it is that we as therapists are listening to in the body. So if you'd all like to close your eyes, and maybe put your cups down in your notebooks or whatever. You need to put your notebooks down actually, just for this, if you don't mind. So if you'd like to close your eyes and feel your sitting bones on your chair, feel your back supported by your chair, feel your feet on the floor. And just be aware of sitting in the chair. Now I'd like you to bring a hand to your chest where your heart is, just over your heart. And feel into the surface of your hand, and almost feel underneath the surface of your hand into your skin. And you should pick up the beating of your heart. If you don't, there's a problem. I'll just let you experience the beating of your heart for a moment or two. It'll be quiet. like you to use both of your hands to put your hands on either side of your rib cage. And no need to change your breath or anything. Just notice how your rib cage flanks out to the side and comes back in with every breath that you take. So you're listening to your respiratory system. You're listening to your breathing. Now place both your hands on your thighs, and again just bring your awareness into the surface of your hands. Feel your hands on your skin, on your clothes. And much like you were listening to your heart through your hands and listening to your breathing through your hands, bring your awareness underneath the hands themselves. So it's your thighs, the thighs and your legs. So you should feel a gentle rolling out of the thighs. It's very subtle and it can be quite slow. And then that's followed by a gentle rolling inward of the thighs. And it's quite slow. This is your craniosacral rhythm. Now you may feel other things. It doesn't mean that you're feeling it wrong or anything. But if you can feel the thighs gently rolling out and gently rolling in, this is the rhythm of the cerebrospinal fluid going through your central nervous system. And it can be picked up anywhere in the body. I'll just let you listen for a little bit longer. We have 6 to 12 cycles of this a minute, of this rotating outward or folding outward and rotating back inward. So you can now open your eyes if you feel ready to. And were you able to feel the rhythm, or were you able to feel something, or do you have any questions, or how was that for you basically?
Feel my heartbeat more.
You could feel your heartbeat. What do you mean when you were listening to your heart?
No.
Okay.
Like this.
So
maybe.
What did that feel like?
Just felt nice.
So was it a pulsation? Was it a pulse?
No, maybe.
Yeah.
Yeah, probably must be.
Okay. You Yes, that is. So you may also feel that one side moved further out than the other, or one side didn't move out at all, or it was almost like one side was louder than the other, or slower than the other, or more jagged. And this is what we're listening to the body, in the body, when we palpate the body at different points and we're listening to this rhythm. It can be picked up anywhere in the body. And I will explain more about this as we go on. So this rhythm shows us where there may be restrictions held in the body. So basically we palpate different parts of the body before we actually sit down to work at all. And we're listening to this rhythm. So sometimes the rhythm may be very slow on one side of the body. We do either side of the body. Maybe slow on one side of the body and faster on the other. The rate of it flowing outwards and inwards, you may get more movement on one side than the other. one side may be jagged, or both sides might be kind of jagged, shuddery, or you might feel an area where you can't feel any of the rhythm. And this all shows us where there are restrictions held in the tissues of the body. So when restrictions are held in the tissues of the body, they're held in the fascia, which is the connective tissue inside our body. Some people, actually, they reckon now that the blood and the bones are also fascia. But fascia is like a very thin layer of connective tissue. If you've ever noticed on a chicken breast that there's a very thin layer of tissue over it, have any of you noticed that? That's fascia. So during surgery, surgeons often cast that to the side and think nothing of it, but actually more and more research is pointing how important it is for our well-being and our ability to recover and be well. So this fascia is like one big web, a matrix inside our body that surrounds all our muscles, our bones, our ligaments and our tendons, and the nerves go through it. And it's made of elastin and collagen. So the elastin allows it to move because everything in our body has to move. And the collagen holds it in place. It's the memory, it's the tissue memory. It holds the tissue memory. So, what more can I say about this? What can happen is, as we go through life, the body can receive insults to its well-being through repetitive use, traumas, accidents, things like that, and those insults actually get held in the tissues of the body. The memory gets held in the tissues of the body, and that's what causes the restrictions. So if you can imagine you're sitting down at a computer all day every day, or you're working in a factory job all day every day, your body's doing its best for you to be well and to operate smoothly and satisfactorily, but it holds on to all of this repetitive use and things that have happened to it, and it has to accommodate that. So things tighten up, and as a result, because it's one big web in the body, this tightness can flow into other areas of the body, and in fact it can flow and follow into the dural membranes that surround the spinal cord and the brain, thereby affecting the central nervous system itself. I know this is all very kind of technical stuff, but it's important. I will be moving on to other information. So we listen to this holding of the tissues in the body, the patterns in the body through our hands. And we just use very gentle pressure. It's about 5 grams, about the weight of a 50p coin. And we use depth perception, which means that we blend and meld with your tissues. It's like we bring our perception right into the body itself, where we can feel the fascia, and we follow the movement of the fascia. So as you're experiencing it as a client, you will feel almost like an unwinding in your body, a relaxation in your body, but an unwinding. It's like your body is still on the couch, but you've all this movement going on in your body, and it's very subtle. So there's unwinding, and there's also wave-like feelings, and this is just the unwinding of the tissues and the releasing of these patterns, which helps the body to operate to optimally once you've released all of these. So as we're releasing all of these tissues, you'll find that any physical problem in the body often has an emotional component to it. So as you're working with these tissues and they're unwinding, often trapped emotions and memories and feelings come to the surface. Not always, mind you, because a lot of the time people fall asleep and sometimes even snore during session, which is wonderful too. But it can happen that people get emotional and they remember things from the past. And we call this somato-emotional release. Somato meaning the body, and emotional, emotions. So it's releasing emotions from the body. So I don't know if any of you have gone for counselling, if any of you are counsellors. Very important work. But the memory actually gets held in the tissues of the body in a physiological way. So that needs to be